Hey, so thanks for taking the time to sit down and discuss how our clinical programs can make an impact on your business today. So, first thing I wanted to talk about was the fact that we already have multiple healthcare companies that have partnered with us. Just for a few examples here, you have BGC Healthcare, Signature Healthcare, and Maine Health. These companies, they chose to be a part of our Symmetry program even before we were on any GPOs. And they were able to find a strong positive clinical impact. And because of that, they were willing to implement that program again before those government GPOs were in place. And here, the next slide here is just some Symmetry programs built off the best practices, just so you guys know. And as you can see here, we are certified with the FDA, the CDC, and the World Health Organization, just to name a few. And so the overall goal here for this program is really just to create products that staff want to use, right? So if for example, if your product is causing your employees' hands to dry up over the course of the day, they're not going to want to use that product, right? Their compliance is going to go down. But just to kind of bring light to it, acceptance. So a product that's going to be more sustainable, more convenient for the staff to use is going to create more compliance, which is going to ultimately lower HAIs, right? So this is why we incorporate different things such as point of care and behavior modification tools to increase this compliance, and we'll touch on those point of care and behavior modification later on. Now, to move on just a little bit here, these are the expectations you're going to be getting with our Symmetry product, right? So first off, through clinical evaluation, we consistently prove to be the preferred choice of healthcare workers with our unique gentleness product. There's no drying. Again, it dries quickly, it keeps hands hydrated and prevents drying out, and there's no sticky residue, making it easy to put on gloves even while practicing hand hygiene. And down here, it also saves you money. The product cost is drastically reduced, as well as the reduction of HII. So it's a win-win there. Next thing I wanted to talk about here was the Duke University study here. So what Duke did was they took a 200-bed hospital, and they calculated that they incur about $1.8 million in annual MRSA infection-related expenses due to hand hygiene non-compliance. And to break it down, if they simply increased, and this is only with MRSA infections, so if they increased their hand hygiene compliance by just 1%, you'd be saving an overall of almost $40,000 in that 200-bed hospital. Now, to conclude it, hand hygiene non-compliance is associated with significant attributable hospital costs, and minimal improvements in compliance will lead to those substantial savings. And just to put it in perspective here, MRSA only accounts for fewer than 8% of all HAIs, meaning that there is a whole another 92% of different factors and different ways that HAIs are infiltrated into your facilities. So now if you can just imagine and magnify, if this is only 8% and you're saving $40,000, imagine what 50% could save you. Next thing I want to talk about here is some of our something called a Symmetry Challenge. So a Symmetry Challenge is essentially a setup where we'd set up a table in high traffic areas in your facility so that the product is used, and as the employees use it, they fill out a survey about the product. Now, just for an example here, we went ahead and did a Symmetry Challenge with Aurora Healthcare, and they had 14 hospitals and 3 clinics, and as you can notice here, out of everyone, 1,300 just about preferred Symmetry over the 44 to their current product. And as you can see throughout these statistics, much easier, a lot better quality, a lot better fragrance, comfort, feel, and the fact that it does dry fast. Now, just to touch base a little bit, we have another challenge here. And just so you guys know, we've never lost a single symmetry challenge for our favorable product. And this is another example of that here with Presbyterian Health Services. As you can see that, again, this is an alarming difference between who prefers what. And I think these statistics here can speak for themselves. And then just another one here, just the last symmetry challenge we were able to do with BGC Healthcare. Again, alarming difference with what they preferred there. And as well, same goes for all these statistics here. So this is another thing we wanted to talk about here is our symmetry unit test clinical evaluation. So basically what we were able to do with BGC is we were able to do a month-long testing with the help of Zach, PhD. So we had 440 beds here, a full internal product evaluation, and they included about 3,200 beds, 160 medical office buildings, and 15 acute care hospitals within their healthcare organization. So what we were able to do with BGC was they actually did a symmetry challenge, but instead of with symmetry, they did it with their current product where they had it set up and the employees were surveyed and questioned on the quality and the preference of the product. So when they first did that with their current product, as you can see, there's definitely some alarming differences here. As you can see with number 7, my skin does not feel irritated, not dry, chapped, or rough after using this product. And it looks like 41%, there's just about 50% disagreed with that right off the bat without even trying our new product to compare it to. And obviously this isn't going to be good because, you know, if people's skin is getting irritated and dry and chapped over the course of the day, this is going to cause skip outs to happen where employees are not going to want to feel inclined to use hand hygiene if it's just going to create more of an issue with their skin, and with that that causes a lot more HAIs and does not help with that situation. But however, when they did the test with symmetry, as you can see here, there's a lot better results. So, just going down the list to point out number 7 here again, my skin does not feel irritated after using this product. An alarming rate agreed with that, and compared to the very minuscule percent that disagreed with that. So again, if 90% of people prefer a product, compliance will inevitably go up. Because simply they are using a product that is not disadvantaging or inconveniencing them by any way throughout the day. So there's going to be no reason, behaviorally, why they wouldn't increase their compliance and usage. Now, moving forward a little bit here, we just want you guys to understand that dispensers for hand sanitizer are being installed throughout the hospital to save money and to provide a better product. This is kind of the conclusion of our study with BGC, and they also had announced that not only the new dispenser is more cost effective, the sanitizer contains vitamin E and aloe, which reduces that skin damage, like we were saying, from alcohol-contained sanitizers. And after BGC, especially with all their hospitals and their units, they were actually able to save about $200,000 that year after they implemented our symmetry program. But actually, beyond that $200,000 for their symmetry, once they actually implemented and that was just hand sanitizer, and symmetry is hand sanitizer and hand soap. So once they implemented the hand sanitizer, they moved on and they went ahead and did the hand soap as well, which saved them an additional $170,000 that year. So moving on just a little bit, I just wanted to let you guys know and affirm that all of our formulations follow regulations as well as benchmark efficacy systems. And we meet all the benchmark standards. If you guys need any paperwork or proof of that, we're very happy to provide it. Again, right there. So just wanted to dive in a little bit about program customization. So this is going to help a lot with being able to, increase that compliance like we had mentioned, and just make the hand hygiene experience something that's going to draw people in. So as you can see here, we have some dispenser logoing. As you can see, you're able to, this Shriners Hospitals, they opted to have that top logo there at the top, as well as their quote down at the bottom. And this is some of their material to bring awareness to hand hygiene and really touching on that emotional side there to get people to, increase compliance. Now, moving forward just a little bit, I want to talk a little bit about what I had mentioned earlier, which is behavior modification. So basically what we do is we implement a couple different methods to essentially increase the amount that people are going to be using hand hygiene. And just to kind of provide a little example about this, Adam Alter is somebody that we have kind of worked with and to develop some of these strategies. And basically what Adam Alter did was he did a test called Drunk Tank Pink. So what Drunk Tank Pink is they took a bunch of drunken sailors after their day of working, and they put them in a drunk tank. They put half of them in a drunk tank with just regular gray or blue walls, and they put the other half into a drunk tank with pink walls. After some time had passed, they discovered that the sailors inside of the pink cell sobered up and calmed down significantly quicker than people inside of the gray or blue or non-pink walls in there. Now, another example of this, how color can kind of affect someone's behavior significantly, would be they did a pull force test where they had a handle, basically an exercising pull machine, and they colored it in pink, and they had someone try to pull it, and then they colored another one in blue and had them pull it. And what they realized was when someone had the pink color, they weren't executing very much force. It was a weaker pull versus the blue, which was much harder and drastically higher in force. And those are just some examples of how color can affect behavior, but placement also variation is very important and can influence behavior very significantly. For example, if you have kids, if you've ever been to the grocery store and you're checking out, and your kid is looking down at you're checking out, and you have the candy on the aisle right as the checkout. The kid looks and he sees a bright colored Sour Patch Kids thing. He picks it up and he says, "Hey, can I please get this? Can I please get this?" You say, "No, we have dinner at home. I don't really want to buy you candy right now." You're in line. There's people behind you waiting to check out. The kid starts having a little bit of a temper tantrum, and then you look around. People are looking at you in the store. They're making eye contact. Then naturally, typically the parent will cave in and buy the candy, take it, and slap it right on the checkout. So that's just an example of how placement is very important and crucial with behavior. This candy, these bright colored candy, it's all displayed on the bottom shelf right at eye level with the child. So those colors really pop out and they see it, and that's how they get right to the parents through the children with that marketing strategy. So just to move forward here a little bit, we actually through incorporating some color and tools as well as placement tools, we kind of narrowed down 6 unique key tenets that inspire hand hygiene compliance specifically. And those are benevolence, responsibility, accountability, variation, emotion, and direction. So just for a couple examples here, for benevolence, we have a couple different things here listed. I mean, benevolence could be anything from just saying help the kids, care for them, basically trying to get the sympathy of someone through the strategic messaging campaigns or displays, placards that are used throughout your facility. Direction. So an example of direction would be placing dispensers, strategically throughout a facility so that people use it at the specific times they should throughout the day. So, for example, There could be a dispenser that's in front of the main entrance that says, sanitize before you start your day. And then they have one later, sanitize before you eat, right near the dining area, for example. So that's just how direction can kind of influence a little bit. Variation as well. So variation of colors, like we said, colors evoke emotion, they evoke action. So variation, just having different, making sure there's a variety of vibrancy and contrast so that it's eye-catching. And another example of BMOD that we typically use is with eyes. So, here's another example of behavior modification. Someone set up this was a test done. Adam Alter also had to do with this. There was a jar of coffee, and the coffee was filled. And, as it ran out, there was a sign that said, please, give a little bit of a tip, give a little money in this other, bucket to the left so that we can refill the coffee, right? So at first they had a picture, a painting of flowers right above the donation jar, right? So people walk up, they're filling up the coffee, come to the end of the day, coffee was empty and there was little to no money inside of the donation jar, right? And then what they did was they changed it. So they took out that picture of the flower and they threw in a picture of an eye, a human eye, a photograph. And what happened was the jar was full by the end of the day. So people are evoked and brought into action through when they were being looked at. So when someone is being looked at, you almost feel like you have to comply. You have to, so someone feels like someone's watching you, right? So you want to be on your best behavior. Therefore, having different strategic messaging and different placards, such as this one, having some image of eyes or a human eye looking at you, we found drastically increases compliance. So how do we apply this to hand hygiene, right? So this adds newness. When newness fades, placards, they catch attention, and we can have all the tenants work at once. And it'll kick on when someone is near a dispenser, which is essentially the visual lighting cue here. So let me backtrack just a little bit. So moving on from just our behavior modification here, we just have a couple examples of that. As you can see, this even promotes exactly how you should wash your hands, just so everyone's doing best practices. And then as you can see here, this evokes direction with the loud stop here, please clean your hands. And then with the little children's hand, that evokes the emotion tenant as well. I'm moving on a little bit here. We've developed some other technology and pieces of equipment that can kind of, aid and abet this behavior modification piece. So Motive is something we've introduced, which are digital behavioral driver placards. So instead of, this just, again, like I was saying before, it adds newness when newness fades, because obviously, if with a regular placard, you're not going to be replacing it, every day or every week, right? But if you have a digital one, you simply can, display anything that's relevant to the time, or anything you really want. Always change it up whenever you'd like. It's very simple. You simply just connect your computer right to it and upload whatever you desire. Now, another thing that we have is our visual lighting cue. So this flashing light actually increased compliance by 49%. They actually did a study. A nurse actually, came up with the idea to basically say that if there's a flashing light on a dispenser, it has a sensor, so essentially the light will kick on when someone is near it, and it calls attention right to the dispenser. And that essentially will cause them to see it, they see the light, and then they're pointed right at the dispenser. I might as well use it, right? So it's promoting that action. It's drawing people to the dispenser. And again, they found a 49% increase in compliance with simply using a flashing light on a dispenser. Now, another thing we have is our behavioral beacon. So our behavioral beacon is really cool because it's similar to the flashing light cue, but it gives you more of that just-in-time coaching. It gives you that positive reinforcement with the smiley face, right? And it gives you patient engagement. So basically how this works is if someone is wanting to see that projection or see the little, smiley bubble pop up on the floor, you have to use hand hygiene. So you're not going to get that positive affirmation. You're not going to get that bright, fun little projection on the floor unless you push that lever. And people start to know that over time, and because of that, they want to get that positive reinforcement. They know what happens after they push it, so they continue to do so. And again, it engages patients. It adds a little something to their day, and gives you that instant gratification. And the other thing that helps is it kind of works down the chain. So when an employee witnesses another one using it, they say, oh, wow, they got that gratification. This happened when they used it. They're going to go up and follow suit, right? And it also provides that talking piece to your patients. Like I said, patient engagement. When they notice something, they see it, they say, oh, that's nice. And then you can kind of provide, exactly why you have it. And it puts safety in the hands of patients as well. Meaning that if, for whatever reason, they don't see that bright light flash on the ground when their doctor or nurse walks in their door, they can say, oh, did you practice hand hygiene? That gives them that extra check, if you will. Now, radar by Symmetry is something we've introduced. So this is essentially used for data collection. So basically we're able to, we took Santer outside patient rooms. The baseline, this is a dispenser without B modification. As you can see, it kind of hovers pretty low there. This is the average over about 4,400 over 3 periods. It's like about average 640 a day. And then once they introduced behavioral modification with that mirror, so the mirror that they put above is also, links in with someone looking at you. So typically when you see a reflection, similar in grocery stores, how they put the reflection, they have a mirror right above the fruit, so that you're more inclined to pick up that product, because when you see yourself in a reflection, you typically want to do more good for yourself, and do things that are healthier, do things that are more improving and positive for your health, because you're looking at yourself. And that's why we implemented a mirror in some of our behavior modification options. And because of that, simply that mirror that they placed in, as you can see, the compliance spiked, and went up 2,900 from where it was. And then also with that VLC, that projection gratification we talked about, and that yield placard, as you can see, which very attention grabbing, also spiked that compliance significantly compared to where they were before, right? And radar, this is all simply just to show. This is just an example of what it can do, but this is essentially what you can see with our radar system. So you're able to track all the ongoing things within your facility. You can see what's working, what isn't. You can see exactly how much has affected your actual compliance. That way you can be very proactive and, pivot and problem solve as time is going, because you're seeing in real time if your facility is improving or not and how it is. Now, you can see what's working and what isn't working, essentially. So some of our products I like to talk about. So just moving forward a little bit here, this is just our full line of our Symmetry products, our chemicals. So we have hand wash products here. We have some hand care products, which is some lotion, just to condition your skin if needed, and then sanitizers as well. We do have a line of Green Seal products as well. 2 of our hand wash, one scented, one unscented, are Green Seal as well. If that's something that pertains to your facility, something that you guys are passionate about. And moving forward here, we have our point of care products. So essentially what point of care is we came up with it because we realized that we must add accessibility for staff to practice hand hygiene, because when you're in a room and you're in the patient room, there's really not a lot of space to have those hand hygiene stations available. And due to that, a nurse is going to have to do something with the patient, or they touch something accidentally, or they touch something, they have to run all the way outside into the hallway or wherever else the hand hygiene product is in order to, comply with it. And again, that's going to drive your compliance way down, because people aren't always going to make that huge effort of time wasting to be going back and forth through it with the patient. So Beginning January 1st, 2018, any observation by surveyors of individual failure to perform hand hygiene in the process of direct patient care will be cited as a deficiency, resulting in a requirement for improvement under the Infection Prevention and Control chapter for all accreditation programs. So this is from the Joint Commission, but basically to kind of promote this and help with this, we the location in which three elements come together: the patient, the HC worker, and the care or treatment involving contact with the patient or patient surroundings. It's essentially what point of care is in a nutshell. We have no RFI because point of care provides optimum placement within the patient's room. So you don't really have to worry about any type of, having to succumb to RFI or anything with the infection prevention control. And through having those point of care tools in the more convenient spaces within the rooms, we don't have our own system because we don't want quality sacrificed from chemical and product. And we don't want to compromise one or the other. We want to do the best we can. So that's why we kind of have that. And so this is just some examples of point of care. As you can see, you're able to incorporate some sanitizer right there in the edge to use right as you're right with the patient. You have a sticky, a suction container there so that it's sturdy. As you can see here, there's even one hanging right off the bed there, right off the edge of the table, right there next to the bed again. And here's just some more examples as well. As you can see, there's hanging options, there's stick options, there's just, basically we incorporated any possible way you could to make sure that there is hand hygiene right directly there, right next to the patient, just so your nurses aren't either not complying or taking too much time to comply with it. Now, this is our monitoring system capability. So we partnered with Clean Hands, BioVisual, Proventix, and SwipeSense. And like I was saying, we don't have our own system because we don't want the quality sacrificed from our chemicals and product. We don't want to create our own monitoring system because that would just bring a lot of care and attention and quality kind of assurance away from that the chemical and product side, which is really the most important part. And it really just is something where we were able to partner with companies that do it the best. Why not, join together and give the best experience possible to the people that need it? And that's why we use the best companies we can. However, we do have a hand hygiene observation app. So this really helps you, again, similar to the radar, but a little bit more just kind of detail oriented. It can track who wasn't compliant. So through data mining, and it's able to identify where the facility is at basically with hand hygiene. So it collects with the app, and then it has that two-way data encryption, which allows you to see all the analytics on desktop, right? So you're able to see who's using hand hygiene and who isn't. This way you can really be proactive, like I said before with our radar. You can be really proactive with making sure that people are being compliant. If there's a drop, you're able to see it quickly before the HAIs are starting to increase, which is great to keep up with for hospital staff. Now, overall, I would just like to say that we found a lot of success with this program, and if you were able to find fit for you that improved your hand compliance and overall just drove down those HAIs, would you be interested in setting up maybe a symmetry challenge like we had discussed, so we can set up a couple tables just to test out the product and see how your employees like it? Great, yeah, and like I was saying, man, you got to have a good product and good behavioral tools to really maintain compliance. It's really not just about how good the product is, even though that is an important factor, but it's the gateway to how you draw those people into the product, because the product's not going to just sit there and use itself, right? So when works best for you for a symmetry challenge? 10 a.m. to 2 p.m.? Perfect. All right, so would next week around 11 a.m. work for you on a Tuesday? Perfect. Awesome. All right, sounds good. Thanks for your time.